Bismillah ar-Rahman ar-Rahim. My name is Abdul Amir. I will talk about toxicology. Case report about acute copper sulfate poisoning. The case: a 22 years old unmarried man working as a painter was found unconscious at his friend's residence. The patient developed hypotension, hemorrhagic gastroenteritis, and hematemesis and melena, renal and hepatic failure, severe metabolic acidosis, and intravascular hemolysis during admission at hospital. His signs were refractory to treatment with fluid replacement therapy, vasoactive drug, antiemetic drugs, ranitidine, and furosemide, methylene blue, and 2,3 dimercaptopropene 1 sulfonate. Background: hypotension, cyanosis, uremia, and jaundice can be considered as a signs of poor prognosis in copper sulfate poisoning. Copper sulfate injection is life-threatening due to its deleterious effect on upper GI, kidneys, liver, and blood. Clinical picture for this case: post-mortem findings of the patient, external examination. Picture A: cyanosis on lips, and picture B: cyanosis on nails bed. Last picture: a hemorrhagic and greenish blue stained mucosa of the stomach. Diagnosis: how diagnosed? Multiple subpleural and subepicardial hemorrhages, and the gastrointestinal mucosa was congested, hemorrhagic, and greenish blue in color. The liver on histological examination showed submassive hepatic necrosis. On toxicological analysis, copper sulfate was detected in preserved viscera, and results for the heavy metals were negative. Second slide about treatment. In case of injection, the contact damage to GI mucosa can be minimized by drinking large quantities of milk and water. Anemia from hemolysis or bleeding must be corrected with transfusion of packed red blood cells. Methemoglobinemia should be treated with methylene blue by intravenous injection of 1 to 2 milligram per kilogram for every dose, and repeated if cyanosis persists after an hour, as high dose of methylene blue can itself induce hemolysis, and it is also contraindicated in glucose 6-phosphate dehydrogenase deficiency. Hyperbaric oxygen and ascorbic acid can be alternatively used. In additional exchange transfusion was shown to be effective when methemoglobinemia is poorly responsive to methylene blue. Renal failure must be identified early by careful monitoring of serum creatinine and urine output. Although hemodialysis has been shown to be ineffective in clearing copper from the body, it is essential to reduce serum creatinine and save the patient's life. Fate of the patient: he died 6 hours post-admission because copper sulfate is life-threatening due to deleterious effect on upper GI, kidney, liver, and blood. Next slide for the references. Finally, thank you.